Mental health advocates and local officials say that state cuts to mental health services will result in more homelessness and put a strain on local law enforcement resources and emergency rooms. The health cuts include the elimination of a 20-bed chemical detox unit, closing 9 inpatient psychiatric beds, closing 10 mental health beds in the emergency department, closing 4 general emergency department beds, closing 24 medical surgery beds, and cutting professional service contracts with Tulane physicians and professionals.
I get sick, I have to have alcohol to survive.
The mental health cuts have made it more challenging for New Orleans' most vulnerable population to receive help. Tim has been living on the streets of New Orleans for over a decade.
Stop.
I told you you're bleeding out of your eyeballs and you're going to die.
They told me, no, we can't help you.
The health cuts are putting a strain on state hospitals. LSU Interim Hospital no longer has the capacity to admit and take care of all the patients at one time.
Our ability to care for all patients will be reduced.
The homeless population is running out of options to receive help.
I guess you have to get locked up and go to jail, and then the judge say, okay, I'm going to refer you to the rehab.
This type of thinking isn't far from the truth.
It's either jail or nothing.
This may be one reason why New Orleans has such a high incarceration rate overall.
It's just a math equation.
In a story published in the New Orleans Gambit Weekly, medical director for the Orleans Parish Prison, Sam Gore, estimated that about 45% of the inmates at prison may suffer from some form of mental illness. Spanning over the month of March, the New Orleans Police Department responded to about 49,000 emergency calls. There are about 300 calls from mentally ill patients.
When the police are handling these calls for service here, they aren't out there doing police work or patrolling.
The United States has the highest incarceration rate of any country in the world. Louisiana has the highest incarceration rate of any state in the country, which has the highest incarceration rate in the world. New Orleans has the highest incarceration rate of any city in the state of Louisiana.
Nationwide, about 4.4 million people are served by mental health systems. In 2010, 8% of those with documented mental health issues were either being treated in an institution, in jail, or homeless. 3.3 live in mental health institutions. In Louisiana, 52,000 people are being treated in the mental health system, but only 0.7% live in an institutional setting.
If they had better facilities to keep these people in, maybe they just wouldn't have these routine calls for service involving persons who are mentally ill.
There is one reason to remain optimistic about the future of healthcare.
This might be the thing that has finally sort of galvanized people to realize that this is a problem that we need to deal with. We can't just keep ignoring it.
Recently, the State Department of Health and Hospitals hired Magellan, a publicly traded managed care specialist, to run an overhaul and expansion of mental health and addiction services for the state's Medicaid and uninsured populations.
We're in the process of trying to collect that data now.
Unfortunately, the city won't know the full effects of the mental health cuts until December.
At Loyola, I'm Kate Schlesinger reporting for The Maroon.